so it's back to school for South Africa's kids today. But as we try and motivate them to get back into the swing of things after a long break, the concern about long-term learning loss, of course, is growing. So that's one set of anxieties. And children, of course, medically have not in general been hardest hit by COVID-19. But we know that any congregant setting becomes a risk, particularly with a more transmissible Delta variant. Well, let's talk more about kids and COVID with Dr. Tendesayi Kufa-Chakezha, an epidemiologist at the National Institute of Communicable Diseases. Doctor, good evening, and thank you so much. You've written a really interesting article in the Daily Maverick, just breaking it down for us, exactly how frequently children are or are not impacted by COVID-19. And you make a really good point that children under the age of 19 or 19 and under, they make up actually a third of South Africa's population. We do have a very young population, but they account for just about 10% of COVID cases. So it definitely is an illness that affects you more the older you get. But still, children do get sick from COVID and they die. So just talk to us about the risk factors for children, what we know about kids and COVID.
Okay, thank you very much, Sally, for inviting me. And as you correctly point out, what we've found in our data at the NICD is that children of all ages, from neonates, newborns, to the 19-year-olds, which is our cutoff for analysis for children, they all can get affected with COVID, and they can die from COVID. They can get severe illness, but that happens much less frequently compared to adults. As you said, although children make us there are about 36 million children under the age of 19 in this country, and as you say, that's not 36 million, they're 36%, so about 20 million children under the age of 19 years and younger, and they make up 10% of the cases. So immediately we can see that they're underrepresented in the number of cases that we are getting from COVID from the beginning, and they made up 4% of admissions, which means severe disease even less likely, and they make up less than 1%, actually 0.7% of deaths. So it's even more likely for children, less likely for children to die, from COVID compared to adults. Having said that, we do need to be careful. Before, in our previous report, our latest in-depth analysis of COVID in children, we were finding that there was an increase in number of COVID cases, particularly in the older adolescents and teenagers, so that your 15 to 19-year-olds, and their rates were going much higher, and they were matching young adults and the average for the country in the weeks from the onset of the third wave up until the time, the 19th of June, where we did the last in-depth analysis. We are working on another updated analysis, so we'll be able to give the country updated figures soon. But we were concerned at the rate at which young adults were getting COVID compared to previous periods and previous waves. So, yeah, that's always a concern. But the much younger children, the under 10s, were not as affected as the older teens in terms of the increase in case rates. But generally, the burden in children tracks that of adults. So when we have huge community transmission and a lot of adults with COVID, we see that also being reflected in the numbers among the children.
All right, so we know that with Delta, it's so much more transmissible than earlier versions of the virus. When you say you've seen an increase in particularly the 15-year-olds and up, is that just an increase in raw numbers because there have been so many more people, specifically in Gauteng, who've had it? Or are we talking proportionally more kids of that age are getting it than with previous versions?
It was proportionally more children. So in the early weeks of the third wave, we're seeing that this trend is being reversed. As the cases come down, we're seeing proportionally less numbers, also less proportions in that age group. But for a while, if you looked at the curve, it was really worrying, particularly for that age group, that there seemed to be, a particular increase proportionally in that group compared to the rest of the age groups in children.
Do you know why one child will get a mild or even asymptomatic illness and another will fall really ill? Is it the same sort of comorbidity risks that we see with older people generally, or is it difficult to say?
So generally, children with underlying conditions, just like adults, are more likely to get COVID and also more likely to get severe COVID when they do get it. So what we have seen is that in our hospital data, children with underlying conditions are overrepresented among those that die. So although about 20% of children who are admitted to hospital and for whom that data is available have an underlying condition, they can be respiratory, diabetes. As you know, children can also get diabetes, TB, HIV. They make up more than half of the deaths, about half of the deaths when you only have about 20% of the children that are admitted with an underlying condition. So we know from that analysis that children with underlying conditions are more likely to get severe disease and are also more likely to die from COVID when they do get it.
You say,
so,
yeah.
You know, if you're a parent of a child with an underlying condition,
got to be
you
particularly careful.
Be careful.
But I have to ask you, and this is because we're still discovering what this virus is all about. Have you had then cases of perfectly healthy children and then they get really sick and die from COVID? Is that happening?
I'd like to say yes, it can happen. The problem with the data that we sit with at the NICD is this is hospital data that gets reported to us. So often, if the report comes in and there's no underlying condition reported, it doesn't necessarily mean that the child didn't have an underlying condition. They may well have had an underlying condition, but maybe it was not diagnosed, or it was diagnosed, but it was not recorded. But we've had what we do keep is a register of the children that die, and we get in touch with the facility to try and get more information about the deaths so that we can understand, you know, why these children died. And one of the biggest limitations that we have with our data is that this is a child who was COVID positive, were admitted in hospital, and they died. It doesn't necessarily mean that they died from COVID. They may have died from whatever else brought them to hospital, or whatever underlying condition they had. You know, children with cancers, they are in hospital, they acquire COVID, and they die. So,
Doctor, you know, I'm just going to ask you on that point. Right at the beginning, when we started tracking COVID numbers over a year ago, we had a situation where a child, and there were a number of cases like this, had a car accident, had died of their injuries, but it was still marked as a COVID death because the child had tested positive. Has that issue been cleared up in our hospitals as yet?
Yes, it has been cleared up. What we do is, when we do the audit of the deaths, we do ask and we go back and revise the data and say, was this death due to COVID or definitely not related to COVID? Most of the time, we can't say whether the child died of COVID or not. What we can say is, you know, in that case of the road traffic accident that you bring up, Sally, that, you know, they died from their injuries and it's most likely not COVID related. So there are cases where, it's a premature baby born to a mother who has COVID and they also test COVID. It's most likely they died from the complications as a result of prematurity. And so some of those cases, based on the judgment of the attending clinicians and based on the evidence that is available, can be reassigned as not COVID related. But as you can understand that sometimes it's not possible to tease out exactly what the cause of death was.
Yeah, I'm just pleased to hear that those very obvious cases that it wasn't COVID have been sorted out. Very last quick question for you. Is it true that babies under 1 are particularly vulnerable to COVID? Well,
when you talk about vulnerability, there are two issues. There is the likelihood of getting COVID. So we are seeing that proportionally they are not more likely to get COVID compared to the other age group in terms of their case rates. But the ones that are admitted, they are overrepresented among those children that die. So although they will make up, you know, less than 4% of admissions, the under ones, they're making up about 20% of admissions. Less than 4% of cases, they'll make up about 20% of admissions and then make up a third of deaths, for example. So I think that's what the proportions, I can't remember all of it at the top, but they are overrepresented among children that are dying from COVID in hospital. So then again, it goes back to the discussion we were having earlier, that children in this age group tend to have other things, diarrheas, infections. Mortality generally in children is higher in the under ones. So we don't always know why, but we know that if a child who's under 1 gets admitted with COVID, proportionally more of them are dying from it compared to the other age groups.
All right. Well, thank you very much for putting that into perspective and giving us such a comprehensive breakdown of COVID and children. That was Dr. Tendesayi Kufa-Chakezha. She's an epidemiologist at the National Institute of Communicable Diseases.